All right, everyone. I know people are still coming in, so I'll go ahead and I'll do my spiel, and then they have a packed presentation today, so I want to be respectful of everyone's time. So we will go ahead and get started as people continue to come in. This is the belated but last of our 2022-2023 Community Table Series on mainstream services. We are really excited to have staff from Kentucky Voices for Health here today. The series has been sponsored by Anthem Medicaid. We are excited to continue it into the future year. You know, everyone who has signed up, we have your contact information, so we will let you know as the new series comes online. We have hired a new training and coordination manager, and she will start August 1st, so expect to hear more about future trainings then. And with that, I will go ahead and turn it over to Emily to start her presentation.
Well, thank you for having us. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health, and I'm here with my colleague, Kara Stewart.
Hi.
We are policy advocates. We are consumer advocates, more specifically, really focusing on making sure that Kentuckians have a say in the decisions that affect their health and well-being. And we do that primarily through policy advocacy, looking at that system level change. And that can take place on the executive branch side, the legislative side. But we want to make sure that people are civically engaged and talking with the policymakers, decision makers who are making these decisions about how our healthcare system works, how our public assistance programs work in Kentucky. And we really want to make sure that they are equitable and that everyone is getting the services and the things that they need, their basic needs met in order to thrive. So we work with a lot of partner organizations, and you'll see that on the slide deck I'm about to share. The logos here really tell you who is part of our Thrive Kentucky coalition. And we have put together monthly updates on state and federal policies, and in particular, public assistance programs and other basic needs that Kentuckians have, so that people know what's changing, good or bad, what you can do, as a community professional, as somebody who is working with Kentuckians in your community and helping them, whether it's with housing issues specifically or with other needs. So, in terms of advocacy, we want to give you, some of those kind of steps you can take, but we also just want you to understand, what's changing with particular programs and what resources may be out there for your clients. So as we go through this, we're going to share a lot of information. Just put questions or comments in the chat and we'll try to get to them as we, go along. And feel free to unmute and ask a question too. And if we don't get through everything in the next hour, we're happy to send you any other answers, or materials that you may need as a follow-up. So I'll just start kind of clicking through our presentation so we can get to everything. Thrive Kentucky, in addition to monthly webinars that we do, and I'm kind of giving you today the content from our monthly webinars, just a little bit distilled down. We usually do this in 90 minutes, and today we're going to try to do it in an hour. But we also do a longer program where we talk a little bit more in depth about some of these programs, these different topics like housing and childcare and food, healthcare, of course, and advocacy. And we do these in person. We call it our roadshow. We'll be in Louisville on September 19th, but you can see here other locations, some that we've already been to and others that are upcoming. And there's a link there if you'd like to register for that, and it is free. And so today we're going to touch on all of these items. And this, like I said, it's a lot of information, but we want to make sure that, we're sharing the information that you need. So if you have specific questions, be sure to put those in the chat for us. And We're going to start with an update on some important Medicaid regulations and things that are happening during the interim session in Frankfort, and Kara is going to walk through that.
Yeah, hi. So these Medicaid regulations, which I don't see the slide. There they are. Okay. I want to make sure they're gone again. Okay. That's super weird. Okay, so this is perhaps our most exciting news of the day. I would love to know how many people already knew this. If there's a way for you to like put that in the chat or do something, I would love to hear who was already hip to spreading the word about the first time in Kentucky that we have had dentures covered by Medicaid. I mean, it's a huge deal. We've had tens of thousands of Kentuckians take advantage of this. And the one that was most surprising to me, so last year, the governor said, hey, look, we've got enough money in our Medicaid budget to do this. It's the right thing to do. We're going to do it. And so January 1st, hearing, vision, and dental were radically improved in terms of the services that they covered. And they added basic things that should have, I think, been there all along, like fillings and glasses, because we've always covered screenings, but not glasses. And you can imagine how frustrating that is. And even though the MCOs mostly is a value-added benefit added glasses, Kentuckians all of a sudden this January started really taking advantage of this. Nearly 60,000 Kentuckians have now gotten glasses, many for the first time. So very big deal. And it cost our state, I've joked and said that it's about the same as copy paper, but I'm not actually sure that it's not the same as copy paper and paper clips out of the Medicaid budget, which is over 20 billion. And this is 5 million to cover 1.7 million Kentuckians to have comprehensive hearing, vision, and dental. So spread the word. The slightly bad news is that the ARS, Administrative Regulation Review Committee, found these regulations to be, the emergency ones, to be deficient already this year. And so they're under attack. There's a threat. But right now, Kentuckians with Medicaid are still eligible to have legitimate hearing aids and glasses and their dental needs met. So please spread that word, give people appointments as fast as they can. We do know that there are not enough providers in network to make it as real as it needs to be. And so KVH, as policy advocates, we've advocated for a change to the regulation to say that if someone has tried to get these services in network and been unable to in the legally required time and distance standards, that people be able to schedule anywhere they can and their MCO still pay for that. Because we think that's the right thing to do to make this realistic. Because the networks, I think we all know, are inadequate. All right, so the 2023 legislative session, it was a short session, which I'm sure you all know means nothing, but it's supposed to be just like adjustments from what didn't exactly work right from the session before. We were told that the entire time. And then there were 900 bills filed. Woo! And 107 of them became law, which is a huge number with a ton of changes. So this is our division. It was 80-20 in the House, but we had Representative Lemeen Swain died, and his seat won't be filled until the election, but we still have a supermajority Republican in both of our chambers. Next slide. Okay, what's going on now since we're not in session? So, we're not in session, but we are in interim session, which is like kind of like session, but they don't actually pass the bills. But hearings matter. And if you're not having something heard now, when they have a few more minutes and not quite as pressing, then it's not likely to be heard during the session. And right now, we have got so many special committees and task force. And I hope that's on our next slide. There they are. 7 of them, y'all. So many. This is in addition to the standing joint committees. So all of the normal committees, all of the local government, the health and housing, the health and human services, like all of the normal committees are still meeting, plus these. So there's a lot of state governing going on. It's an easier time to be engaged and show up because it's a little more chill, it's a little less busy. If any of these, all of these are going to produce something, and they all need to hear from folks. So the calendar changes constantly. Check up. This is when we say to reach out because they're more likely to be reachable. And of course, you know, you can go to legislature.ky.gov to get all of the info and how to contact them. We always recommend thanking them for listening to us, of course. And no big surprise, this year's an election year. If anybody, I'm sure everybody here already knows that all of our statewide elected offices are on our ballot this fall, which is huge consequences. I would like to be very clear that I am confident that in prior administrations, we would not have hearing, vision, and dental right now. We would not be having dentures for Medicaid, but we do right now because of our current administration making that a value. So make sure to vote, spread the word to vote, make sure everybody knows that it's important to vote. And today we just had the announcement that Senator Robbie Mills will be the running mate for Daniel Cameron, who'll be on the ballot against Governor Andy Beshear and Jacqueline Coleman. All right, next slide. Okay. The CHW, I wrote this down so I wouldn't mess it up, but I think it's still me, right?
It's me, Kara.
Okay.
I was messing with my PowerPoint settings. I just realized I didn't have it in presenter mode. All right. So Kara said that she got the best news of the day, but I'm not so sure because, July 1st, certified community health workers can now be reimbursed by Medicaid for certain services. So that's pretty cool. It's something we've been advocating for since the Affordable Care Act allowed for it. So starting in 2014, we could have been doing this, but it's taken a while. We did need a certification process in Kentucky. We needed, training and certification and core competencies and all sorts of things kind of established so that CMS, the federal, Centers for Medicaid and Medicare Services, would approve our plan. And then we had legislation passed in 2022, House Bill 525, that directed the Department for Medicaid Services to request federal approval to allow for CHWs to bill Medicaid. And that has happened. So we have approval. We have now a fee schedule. We have the services outlined, and I'm going to share that information with you. And here, if you want to see any of these documents, there's the state plan amendment that was approved. There's a certification regulation. And now specifically to billing, there's an overview, some frequently asked questions, and 2 letters that Medicaid sent to providers and to dentists specifically about billing, and then the regulation itself and a link to the manuals. So one thing that happened during this process as we were trying to figure out, how is billing going to work? Who's going to be able to bill? There was some concern about community-based organizations not being able to participate, but CBOs can participate. So even if you don't work for, a Medicaid provider that is more, sort of the traditional provider, which would be a clinic or a hospital or some other kind of healthcare facility, a CBO can either hire someone who's a Medicaid provider, like a licensed physician or APRN, or could contract with a Medicaid provider who would be eligible to bill for Medicaid services, because the CHW themselves would bill under this licensed provider. But here are the covered services. And it's quite a bit, really. There are 3 codes that keep it pretty simple, but those codes can be used for any of these things. And we know that so many people need help navigating the healthcare system, just understanding, what their condition is and their treatment plan and so on, getting to the healthcare appointment. All of those things are eligible now for reimbursement. Patient education, just being a liaison, sort of coordinating that care, and chronic disease management, immunizations, managing STDs, diabetes. There's a lot here that you're going to be able to help with if you are a certified community health worker. And then these are the billing codes that I mentioned, and they're really just a different code based on whether it's 1 patient, 2 to 4, or 5 to 8. And these are for 30-minute increments. And right now, there's no restriction on place of service. So originally, the state was saying it could only be within the walls of a healthcare facility. They got a lot of feedback on that. We told them that's not how CHWs work, and we really needed them to be in the community. And so there is no restriction on place of service. They can be, doing street outreach. or going to people's houses or into shelters. But there is a max of 2 units per patient per week, which I don't think is reasonable. I don't think that's enough. We are going to be pushing back on that. The regulation was just filed, and so we have a public comment period in which we can suggest changes. And we are going to be putting together template comments so that, you know, organizations like yours and, you know, community health workers themselves can be submitting comments and saying, we need these changes to make this work for our clients. And there are a few other changes that we want to see too, but this is a really good start. And so I mentioned already that CBOs can bill. There's another big sort of question mark around if you get some sort of grant funding and whether or not you can bill. And our template comments will go more into detail there. I don't feel like we have a ton of time to cover that today, but feel free to reach out to me if you have questions about it. And then
Emily, can I just jump in and ask one quick question?
Yeah,
if people who are serving people in a shelter, if they were wanting to connect with community health workers to find people who could come into their facility, how would they do that?
You know, I think that there's now a new office for community health workers, or Office of Community Health Workers at the state in the Department for Public Health. And they have a list of every certified community health worker. There are a lot of community health workers, you know, more community health workers who are uncertified right now than those who are certified. I think that's going to change with billing because that's a really good incentive to be certified. But for those who are certified, I think going to the Office of Community Health Workers would be a good place to start if you don't already know of some CHWs that are working in your community. I know at Family Health Centers, there are CHWs. At La Casita, there are CHWs. I think the Volunteers of America have CHWs on staff. There are quite a number of groups in Louisville and this area. But then the Kentucky Association for Community Health Workers also tries to map out the CHWs in the state, and they basically use, you know, their membership as a map. And so they should have a listing of CHWs who may not be certified as well. So I am happy to answer more questions, but just in the interest of time, you know, if you have questions specific to CHWs, put them in the chat or reach out to me and I can tell you more about it. For now, I'm going to let Kara talk about childcare.
So childcare is an issue for everyone. I've never known anyone who didn't. Well, I guess if you don't have any children in your life, that's not an issue for you. For everyone I know who's ever had kids, it's a challenge. So, and this is one of those examples where the individual experience and the data match that childcare is unavailable. Over half of Kentucky is a childcare desert, and a childcare desert means that there are at least 3 children who need one of those spots in that childcare center. And the childcare unavailability has been getting worse over time. Over the past decade, there's been on quite a slide. We have leveled out right here because of investments from ARPA, the American Rescue Plan Act. But those investments, which were to keep doors open because of COVID when children couldn't be there, those checks stopped coming in this September. So we're looking at kind of a real looming cliff of having less childcare available. And then on top of that, I'm sure, again, everyone here knows, I hate to feel like I'm saying this like it's some kind of new information. Childcare is unaffordable. It is expensive no matter where you live. It's expensive. It's as expensive as college tuition. You know, it is almost 20% of the state median income for a toddler, which is just mind-boggling to think about how expensive that is to take care of kids. But why is that? Because childcare is not scalable. Childcare has to be expensive. Babies, no, iPads can never change a diaper. They cannot bounce or soothe an upset baby. They cannot, rub their gums or feed them. It's just that children take a lot of adult attention, and there's no way around that. So we have to invest in childcare to make it good. And right now, currently our childcare workers aren't even paid well. So I think we have to have a future where our childcare workers are paid fairly, and we have enough of them that our children are cared for appropriately. Because Kentucky also, unfortunately, leads the country in child dependency, neglect, and abuse, which I think this is a direct correlation here. If you don't have and we also don't have great workforce participation, also a direct correlation. If you don't have a nice, safe place to put your child, you're maybe not going to be able to work, which affects women a lot more than men. And or if you are, then that puts your child in perhaps not the best situation. All right, next slide. I got Emily back. Okay, so, and we do have child care assistance, which is higher than it's ever been before, but it still doesn't reach everyone, of course. But do just spread the word, though. Our income eligibility for CCAP, child care assistance, is the highest that it's ever been, which is pretty exciting. But not as high as it's ever been, as high as it is. You can see the chart to see when. We, in the long past, did make it even better for folks, but we haven't raised wages. Next slide. So this cliff is coming, but we can do something about it, right? Like Kentucky can decide how to handle this. Kentucky has a budget starting in January, but it's being decided right now. You can go to the next slide. Oh, never mind, go back. So it's being decided right now. So if we reach out right now and say childcare has to be included. So if you all are writing down your things to do from this webinar, one of them is contact your state representative and your state senator and or the budget chairs, Jason Petrie and Chris McDaniel, and say childcare has to be funded, and it has to be funded well, because people can't do anything else if their children they don't know their children are safe and cared for. And then now we can go on to SNAP.
All right, so I'm going to talk a little bit about food assistance. And I think everyone on this call understands that there are a lot of Kentuckians hungry, way too many Kentuckians and children in particular who really are facing food insecurity, and that's entirely preventable. But we do have some programs that are helping Kentuckians access the food that they need. And while we have a lot of Kentuckians, enrolled in these programs, we could have more. So what I wanted to share with you is, the eligibility limits for each of these programs and some of the, the basic sort of eligibility criteria that you can see here. One thing I'll note is that in terms of immigration status, you don't necessarily have to be a citizen of the United States in order to enroll in some of these programs. It is typically required, but not always. And there is no penalty for someone who is undocumented to apply on behalf of other people in the household who may be eligible. And we know that during the Trump administration, there was a real chilling effect because they were, kind of threatening that people who were undocumented could, be penalized in a way where they would not be able to be, approved for citizenship in the future if they were to apply for any of these benefits. But that's not the case right now. That was the public charge rule. That rule is still technically in effect, but applying on behalf of people who are eligible is absolutely okay. And if they're in your household, that's okay too. So that's what we want people to really know. And we want people to feel more comfortable applying for these benefits for the people who are eligible for them. And then in terms of SNAP participation, you can see this trend line here. And unfortunately, it's really been on a downward decline. Even during the pandemic, we never got to the sort of, the enrollment level that we had during the Great Recession. Now, the Great Recession isn't something that, we aspire to, but I think a lot more people are eligible for SNAP than participate simply because the SNAP application and some of the rules for SNAP are hard. And it can be discouraging to people. They simply, can't do all the documentation, meet all those requirements. And so either end up, using it for a little while and losing it, or just never applying. So we want people to apply if they're eligible. And sometimes it may be you or someone that you work with who can help them do that. And here's just a little bit of information about SNAP in Kentucky if you're ever educating people in your community or policymakers. Here's more information about deductions that are available for SNAP that a lot of people aren't aware of or don't know how to sort of take advantage of. So there are deductions for things like dependent care costs, for experiencing homelessness, for legal child support deductions, shelter costs, utility costs, even medical expenses. And like I said, a lot of people don't understand these deductions or how to take advantage of them. And so could be eligible, if they were able to use them. And we have an explainer that I'll get to at the end of the presentation. I'll share a link with you to a new kind of front and back explainer on SNAP eligibility and deductions that you can use to educate people in your community. And then SNAP time limits. This is bad news, but it's something we all have to figure out and deal with. There are reporting requirements, specifically work reporting requirements, that are coming back. They were suspended during the pandemic for people without children or without a disability between the ages of 18 and 49 who have SNAP, but those are going to start again. And the first people, there are about 17,000 Kentuckians who will need to start reporting these work activities. And if they don't report on time, et cetera, they could lose their SNAP benefits as early as October. And then the debt ceiling agreement that happened a couple of months ago, that expanded this from the age of 49 up to 54 now. So that's going to go into effect gradually over a few months. That requirement begins with people at the age of 50, September 1st, and then over the fall, other ages will be added. So that's going to include another about 13,000 people, we estimate, who are now more at risk of losing food assistance. And here's a map of the counties that will have to comply. And the ones that are gray have an exemption from this requirement. Every other county, including Jefferson, will have to comply, and there will be a lot of people more at risk of losing food assistance, because it's not whether or not you work, it's how reporting that and reporting it in a way that, you've done the paperwork right and you've done it on time and it gets processed correctly. So there are lots of ways that people fall through those cracks, especially whenever they're facing housing insecurity and have other things that are going on every day. So another very good program, so back to some good news, Pandemic EBT. This has been a program to make up for meals that were missed during the school year, originally due to kids like not being in school, like very literally not being in school for lunch. But now they've extended it to summer, so that even during the summer when kids typically aren't in school, families are still getting some money to pay for meals. Of course, none of that happens like when the summer is in, here and you're actually paying for those meals, because the state just doesn't operate very quickly. We're going to see payments going out in the fall for summer PEBT. But I will say that PEBT payments were recently made in June for families that have children under 6, and those kids have SNAP. So they got a PEBT payment in June. For school age kids, we're still waiting to see exactly when these payments are going to be made to families. So it's frustrating. We just don't have any answers yet, but we expect that it will be early fall. And then EBT skimming, just something to be aware of. So, people have started using these machines to skim benefits from other people's cards. And if that happens and it's reported to the state, they're able to replace up to 2 months of benefits. And that can be replaced twice a year per household. So that's just going into effect now. And that's not, a solution to the problem, but it will help a lot of people who've had their benefits taken from them. And then I'm going to quickly go through a behavioral health update. Actually, let me check the chat. Okay. I don't think I've gotten any questions yet about food assistance. And if I do get questions about food assistance, I will tell you that I'll probably connect you with one of my colleagues who works on food more than I do on a daily basis. I was actually going through someone else's slides, but we have some great colleagues who are really monitoring these programs and know them inside and out. And we can connect you with them if you have any really specific questions. So in terms of behavioral health, we just want to take a minute to celebrate the anniversary of 988. I think it was actually yesterday, but close enough. It's been 1 year, and in 1 year, we have seen thousands and thousands of Kentuckians use 988, which is a suicide and crisis lifeline. So 988 is kind of a play on 911, but instead of calling 911, which is, I think we all know from the news and probably even sometimes from personal experience, it's not the right crisis line for everything, and particularly for people in mental health crisis. So 988 is really where we want to direct people who are experiencing suicidal thoughts or are in some other sort of mental health crisis. It's not just for suicide, but it is a great new lifeline that we want Kentuckians to be taking advantage of. Over the year, we've seen a big increase in calls. We've seen the answer rate, just happening really quickly. And for the most part, Kentuckians are answering the phone, which is fantastic. Now, in the upcoming legislative session, we're going to be advocating for funding for 988 so that we have even more capacity for Kentuckians to answer these calls. But it's really going well even now without that funding. But we will be probably sending out more information about our advocacy efforts there so that we can continue to support this line. And also good to know that there are now text and chat features for particular populations, Spanish speaking, LGBTQ+. So keep that in mind if you're working with clients who need that kind of support. And then something else to know about, and this is also good news, although we're not there yet, we're not at the finish line. There was legislation passed, a Senate joint resolution in 2022 to direct the cabinet to develop a waiver, a Medicaid waiver for the severely mentally ill. So we call this SMI waiver, but this would be, in addition to the usual Medicaid benefits that people get, this would include additional benefits that people with SMI really need in order to function in the community and in order to thrive and be healthy. And that has to include supported housing. And so that is one thing that actually is not included yet in the waiver that has been filed. But the Department for Medicaid Services believes that we need two sort of vehicles to be approved or to approve this plan. One is called an 1115 waiver. And so that's what we've linked to here. That's already been filed with CMS for approval. And it has some good things in it, but it doesn't have everything we need. There is a focus not only on housing here, but also on making sure that people who are, in inpatient care, getting treated in the hospital, can recuperate and have that housing available to them as well. So we need something called a 1915I waiver that the state is working on now, should be releasing later this summer, we've been told, to get that supported housing piece. And that's where we're going to need your help advocating, because we have some concern that it may not be sufficient for what we really need. So we're going to have to put pressure on the state, and we're going to have to look for, the best solutions for Kentuckians and to get the funding that we need to support that. And my final update here is that House Bill 353, which was passed this legislative session, is now law, and that removes the criminal penalties for owning fentanyl test strips, which is really, really important because we know that so many drugs now are laced with fentanyl, and we want people to be able to identify that safely to save lives. And so I'm going to turn it back over to Kara now to talk about housing and homeless services.
Okay, so here's the weirdest part of the presentation, where I talk to folks who almost certainly know more than I do about this topic. I do know a whole lot about the law side of it, but the law side of housing and who's actually being reached and what it's like in practice is, of course, often very different. So this is, again, I'm sure preaching to the choir that Kentuckians do not make enough money to be able to afford, make housing affordable. So you need to be able to be earning almost $18 an hour to afford fair market housing in Kentucky. And of course, is that our minimum wage? It is not. Our minimum wage is $7.25. And of course, our tipped wage is still back in the $2, which has been that way for most of my lifetime. So we know that we have a huge number of Kentuckians who are not making enough to be able to rent. And then we need a solution. We need a lot more supports. We need better wages, and we need more housing to make that possible. Okay, so what's going on in our housing profile right now? We don't have enough of it. We need plans to be building more, and our extremely low income renter households are in a very hard way. We're extremely low renters, half of them are paying more than half of their income in rent. Next slide. So this is all of the disaster updates. These are live links. When y'all get this an email, you can click on them to see what is going on with these live links. I will say that we did have, for the first time ever, money put into an affordable housing trust for housing in both Eastern and Western Kentucky, but to recover from the tornadoes and the floods, which it was a small amount of money. It's not enough to do a whole lot, but it's the first time we've ever opened that door and had the legislature just fund affordable housing directly. So it's still a big deal. Next slide. This is more about that. This is the Rural Housing Trust Fund that was just created. So this is one of those, like, it is exciting because it's the first time it's happened. But it's not something that's particularly meaningful or real because it's $10 million to each region that had, billions of dollars of damage done. But it is still opening the door that the legislature is acknowledging they need to be a part of using our shared state dollars to build housing. Next slide. So right now, this is true, especially for folks in Louisville, that we are looking to get perspectives from tenants and tenant advocates and lots of folks about what's going on in multifamily properties. So if you know anybody who's living in a multifamily property, if you are yourself, we know that the federal government is looking for public comments on that. So spread that word and use your voice to share what's going on. Next slide. So the request for input is on some of the ideas. And here's the link that you can send a letter with your ideas or provide input directly in like a survey to HHTK, the Homeless and Housing Coalition of Kentucky. They have a template, or you can write your own from Tenants Common. The deadline is the end of this month. So you got to do it by July 31st. But this is important because we have an opportunity here with our current federal administration to make some changes to how federal housing money works, and we need that. So again, as a person who has represented tons of people in evictions and always been at kind of that desperate end and been driving around trying to find somebody who's just evicted someplace else to live, I know there's just not places. And we need just cause eviction standards. We need to not allow for non-renewals for no reason. So yeah, please do this, weigh in. Big deal. Next slide. And Medicaid renewals. So again, I would love to hear in the chat or with raised hands who knows what was going on with renewals. So during COVID, we did not have regular renewals for Medicaid. So we just paused those to make sure that people didn't slide off. And even though it's still COVID going on, we are unwinding that and going back to normal Medicaid renewals. So, but the deal is that normal Medicaid renewals is normally we space that out and stretch it out. And this is going to all happen in a year. And that means that everyone enrolled in Medicaid has got to renew their Medicaid. And hopefully a lot of folks, that'll happen without them having to do very much because nothing will change. The state will know nothing will change. But for a whole lot of folks, it's going to require turning in some new information. And of course, right now, we're looking at only about half of the people who have received information about renewal having turned it back in. So that's like 50% of the folks who are getting terminated from their Medicaid, who almost certainly are still eligible because they didn't return information that was requested. And of course, like I get it, I don't open all of my mail timely, but this is a spread the word. You do need to open that mail. And you can check your date by going into the Connect self-service portal or calling a connector. Or calling the hotline or asking your doctor's office. You can find out when your or your client's actual date is. So you'll know, is it this month or is it October? Is it December? Next slide. This is an example of the notices, just so you can see if what's going out to folks. And the renewal packet is several pages, but these others are pretty straightforward. Just send us this one piece of information. Next slide. So these are the numbers of what all has happened. And again, if you look there, we're looking at a lot of folks who are losing their Medicaid, likely who don't need to be. I don't know that for 100% sure, but most of them are likely still eligible, but just have not been returning that information. So that's what the good news is. The passive cases, the state's like, okay, we're sure that you're already eligible. We're going to keep going here, no problem. But those active cases need something from Kentuckians and haven't been getting it back at about a rate of 50%. Next slide. So the state has done a lot, actually. They really have, not enough. I'm on team, it's time for door knocking, because they've sent a ton of emails, they've sent a ton of letters. Some of the letters, not a ton of letters have been coming back as undeliverable, but we're not sure that means they're actually getting to folks. Tons of emails are going out, they're sending text messages, and they are impressive numbers. It's very impressive what the state has done, but the part that I want everybody to take away from this is that half of the folks who have needed to renew have not. And so it's still, no matter how impressive these numbers are, how much work has been done, it's not enough, and we're losing people, and that churn is expensive. And it can be very dangerous for folks. I have a personal friend who just had a surgery rescheduled because of some paperwork misalignments. That's a life-saving surgery because of Medicaid, because of a wrongful termination, but also, another paperwork kind of issue. So these things really matter. Next slide.
Kara, is it okay if I hop in here?
Yeah.
So I just want to, I guess, because we're talking about experiencing homelessness or, housing insecurity, moving from place to place, living in shelters, I think there's an even higher risk here of people not getting that notice. And so anything that you can do to help somebody find that renewal date is really helpful. I will say, in talking with Adrienne Bush with the Homeless and Housing Coalition of Kentucky, that she, lets people or the coalition has people using their address on a regular basis, if they don't have a mailing address of their own. And when she receives that mail and can't find someone, or knows that somebody has moved out of state or is no longer, seeking their services, she will return it to DMS. And so far, she's continuing to get their mail. So a lot of mail is being delivered, but it might not be getting to the individual that it is, addressed to. And that's something that I think shelters and other housing programs, community-based organizations can be helping with. If, regardless of the notices, if you can help people find that renewal date and then connect with a connector, that's another way to make sure that they keep their coverage. Something else that we have noticed is that, if somebody has zero income, they should be renewed automatically under most circumstances, but that's not always happening. And so helping somebody, do an attestation for zero income, or, just making sure that that's getting documented if it needs to be, is also very important. So I'll just leave it at that, but finding a connector is one of the best ways to help somebody keep their coverage. And I'm gonna let Kara take this back. Sorry, everyone.
Oh, no, appreciate that. Honestly, this entire presentation could have just been on Medicaid renewals because it's such a big deal. We threw everything else in because that's who we are. But we could have talked this entire time about every possible way to reach more people and examples of how to do those attestations, because doing those sort of attestations about zero income is really powerful and important, because a lot of people, those are the kind of hurdles that folks don't overcome. We do have ongoing unwinding stakeholder meetings. This is from the Department of Medicaid. Everybody is welcome to join. It's the third Thursday of each month. It's a 1-hour meeting to talk about what's going on. So if anybody wants more information, or if you want to send somebody from your org to that, pop in there. They do send out numbers every month. It is good that we're getting a lot of feedback. It's just that the numbers that are coming out are bad. So that's good to know that it's happening, but yeah. So in what to do, there are a couple of different steps. So first, you get that notice that we showed earlier, and you can report any change. If you fail to do that, it is not a crisis. You still have 90 days from that termination or loss of coverage, to ask for a reconsideration, where you can just send in whatever that documentation was, and or send nothing in and say, hey, y'all messed it up, right? This is what it should be. This is what's accurate. And then even if they continue to say, no, you're not eligible, you can always ask for a hearing. So there's timelines for that. You have 120 days. But the fair hearing, there's an informal hearing and a formal hearing. So there's actually 2 stages of that piece too. So there's quite a few steps. So nobody's like out of luck, right? And then of course you can also, Medicaid never closes. You can also always just reapply. Go ahead. So, and outside of open enrollment is a confusing term because Medicaid is always open. You can always apply for Medicaid. But for a qualified health plan, which some folks think of like was private insurance that you can get through Connect, you can get that anytime if you lost qualifying coverage. So if you lost Medicaid because you're no longer eligible, which is true for some folks, that does create a moment when they can get qualifying coverage outside of that fall time. In the fall is when we all redo our health insurance. And you can do that any time of the year if you've lost qualifying coverage like Medicaid. And of course, if you've had a change in eligibility for financial assistance, and that's why you're also eligible. Next one. So there's a new feature where you can get contacted on Connect. This is currently, insurance agents, which there are thousands in Kentucky, are paid to assist Kentuckians with qualified health plans. They eventually are going to be paid to do Medicaid, but currently not. But connectors are not like paid per case and all, are available and free to folks. So we highly encourage folks to reach out to connectors, especially with Medicaid, because a lot of insurance agents don't know much about Medicaid because they don't make money off of it. So they don't know a whole lot about it. So we encourage folks to stick with connectors for Medicaid, but this is a new feature. Next slide. We already went over some of this. Actually, I think we went over most all of this, that people with zero income are receiving termination letters and should not be. SSI, we know that there's a problem. We know that there's folks who are continuing to have SSI are still getting renewals when they should not, and that there's terminations that should not be happening. So if anybody's got any SSI issues and or any renewal issues, KVH, we want to hear about it. Priscilla Easterling is our primary contact for that. We also have this very cool website, which called KY Loop, and we want people to stay in the loop. And KY Loop is where you can report these renewal issues. And we think of it like the, Reddit plus Apple Help Center plus Facebook kind of thing. Like we know who you are, and we have real people, and we have experts who are willing to respond and say that's a good answer. That's, and that way other folks can find answers more easily, and it doesn't require us all to redo the same, reinvent the wheel over and over and over again. So I'm really excited. Everyone here, please go check out KY Loop and get an account on there so that we can have these conversations and make sure that we all know what's going on. That we can hold the state accountable with what's going on, and we can do the most to help Kentuckians stay insured. Next slide. Okay.
All right. I'm going to share just a few resources. There are more than I'll go over, but I want to point your attention to these Thrive Kentucky explainers. These are simple kind of one-pagers that we, as simple as they can be for government programs, but that we put together with our partners. That I talked about at the beginning of this. So the Homeless and Housing Coalition, the Kentucky Equal Justice Center, Advocacy Action Network, KY Policy, Feeding Kentucky. They've all helped us to really distill information down about what Kentuckians need to know for these different programs. So you see images here of our Medicaid renewal explainer, and there are links to that explainer in English and Spanish. And that on the back of that explainer, there are the images of the notices. So people see the different notices, how you can find your renewal date, that kind of thing. And if you saw this when we first released it back in like February, we've actually updated it. So go to these links for the updated version. Then we also have an explainer on those special enrollment periods that Kara just walked through. We have 2 explainers on SNAP. One is related to eligibility and includes the deductions. The other is related to those reporting requirements that are going back into effect. And then KTAP, cash assistance for kids and families that are very, very low income. There have been some really good changes there. I wish we would have put those slides in regretting that now, but there's eligibility has changed and there are increased benefits. So families that may not have been eligible before could be now, and your families might want to, check that out. And then mental health, we have a mental health first aid explainer that includes information about screenings and 988. So check all of those out. And these are also always going to be on kyloop.org. We have a nice resources section that we really try to sort of curate so that it's exactly the information that you need to find. And we're going to try our best to keep it updated so that, information that you're always going and looking in different places on different state websites can all be there in one place. And then Kara talked already about the forum, but the forum is going to be a place where you can go with questions if you're looking for something, or if you run into a barrier, you're trying to enroll somebody in a program and something's not working, that's where you can go to ask those questions, and we'll try to get you the right answer and direct you to the right place. So I mentioned that we do these webinars monthly, and this is kind of our distilled down version for you today. Our next webinar is actually going to be August 1st, and it's going to be a quarterly forum with the Cabinet for Health and Family Services leadership. So these we do quarterly so that people can connect with Cabinet leadership, can ask questions, can hear what they're working on, new programs, new initiatives, new changes that are coming. So that's August 1st at 2 p.m. That's almost always on a Tuesday. And then our other webinars are scheduled for September 5th, October 3rd, and November 14th. That'll be another quarterly forum. And then our roadshow, I already mentioned that to you. So there's the link again. And then there's just a number of other resources here that may be helpful to you that I'll just click through so you can see them. But I'm going to stop there. And do we have a few minutes? Yes, we do. We managed to get through all that. If there are any questions, we'd love to answer them.
Oh, Emily, I will ask one. When you were talking about the, I believe the work requirements for SNAP, there was something on there about, it seemed, word am I looking for? An exclusion for people who are experiencing homelessness. Can you tell a little bit about how that works and like what someone would need to verify that?
Yes, I'm so sorry I didn't even bring that up before. So there are some exemptions. We don't know exactly how that exemption is going to work. We're still trying to get more information about that. And so I really don't have a great answer for you, although I can pull up a little more information and send it to you as a follow-up. I just don't want to give you the wrong information off the top of my head. But how it looks on paper as an exemption and how it works in practice is really where the rubber meets the road, right? Like how is somebody going to actually apply for and be approved for an exemption? And that's the problem. But let me see if I can find the information while we're talking. And if I can't, then I will get it to you in a follow-up email. Kara, you might already know more about this. Oh, it looks like Kara's frozen.
I think Kara might not have electricity right now. I'm very concerned about what's going on.
I know she's at her mom's in Eastern Kentucky, and so I think the coverage is just not good there.
Yeah, and while she is looking for that, I really would encourage all of you, and I will make sure the links are included in the presentation, but I will send the link specifically to attend those quarterly webinars. There's so much good information there, and I think some of you have got the hint recently, but we are definitely going to be making a push from the continuum of care side on how important it is to ensure your clients are connected to all the benefits.
The filing for an exemption in SNAP. So some of them should be automatic. There is like.
Oh, you're cutting in and out.
Yeah, let's see if we can unmute Kara. All right. Okay, I think we have lost Kara. Does anyone else have any other questions?
So let me just see if I can pull up my explainer while we're talking. But if people have other questions, go for it.
Okay, we might have Kara on the phone now.
Yeah, I did. I switched to phone. Thanks, Verizon, for choosing to cover Eastern Kentucky.
Okay. So we were discussing the exemption for SNAP for people who are experiencing homelessness. Do you have any information on how someone would need to verify that? What do we know? What do we think?
Attestation. So here's what so hopefully it's going to be expanded. We're hoping that this administration expands it and makes it even easier. But everything that was true in the past will still be true, so that you can do an attestation from a shelter or from basically any professional can say, you know, that I'm signing that I know that this person does not have a permanent place to live. So it's going to be more of that paperwork attestation and uploading. Now, of course, why KVH opposes, you know, it sounds weird to say like we oppose these sort of exemptions, but it's because they just create these hoops that people can't get through.
I think that policymakers often hear that, you know, vulnerable populations.
It won't hurt someone who's homeless. Well, yeah, it will.
And so they end up passing a bill that has more restrictions, you know, or more limitations, and because they think that, you know, the people that are really at risk are going to be protected, and that's just not true. So I think for the most part, even if, you know, we end up having as advocates and as, you know, community professionals who are assisting individuals who may need an exemption, we end up having to do a lot of extra work to help keep, you know, get that exemption and keep them enrolled in a program. And then some people invariably lose the benefit anyway because they don't get the exemption. And so those are all the reasons that we think they're not great, but, you know, we're going to do what we can in this case.
And the fact that we're talking about them right now. Look, we're all using our professional time right now to put in time to talk about how we're going to try to prevent people who are homeless, from losing their food benefit. Like, that sort of proves the point as to why exemptions are not good policy.
But I will get you more details, because I know I've seen kind of an outline of the different ways that the exemption can work, but there are still some, the actual, we don't have any forms yet.
All right. Thank you all so much for your time. Thanks everyone who was able to attend. I will send out the recording and the slides and links once I have all of that processed. So if you registered, I have your email address. Again, thank you, Emily and Kara, so much for your time. Thank you to Anthem Medicaid for sponsoring this. Again, really encourage you to check out all the information Kentucky Voices for Health has. It's so informative and really, really helpful to the people we serve. All right. Thanks, everyone.
Thanks for having us.
Thank you.